So at 9:30, this is a special edition of the lockdown questions here on Republic TV. And today on the panel, we have two eminent gynecologists joining us, Dr. Rishma Pai and Dr. Bhumika Bansal. So if you have any pregnancy-related questions or you want to ask anything from our expert, this will be a live call-in show as the numbers are flashing on your television screens. 02262 431010. We'll be taking your questions live, and any pregnancy or other related queries do you have with the top gynecologists that we have here on the broadcast. I want to welcome both the doctors joining us. Thank you very much for taking out your time, Dr. Pai and Dr. Bansal. Dr. Pai, my first question to you, looking at the current situation where lockdown norms, we are looking at that they have been eased. Are we looking at more counseling sessions that were witnessed in earlier lockdown measures? Because at that point in time, pregnant women, expecting mothers were not really encouraged to go out and visit gynecologists in the hospital or in their clinics. What is, when it comes to the counseling sessions that you have been taking care of, where expecting mothers are directly now coming to you?
Yes. Mumbai actually has been in the eye of the storm since quite a long time. And Mumbai hospitals, particularly the public hospitals, have seen hundreds and hundreds of COVID positive patients coming in. So lockdown or otherwise, the one thing that does not stop is pregnancy and delivery. So of course, there is very strict warning actually across the world that particularly in the third trimester, that is after about 7 months of pregnancy, the risks are quite high of infection and, significant problems of pregnancy. So pregnant women are strictly advised, lockdown or no lockdown, to stay at home, to continue to socially distance themselves, to take great care so that they don't acquire an infection. Because though, fortunately, pregnancy has not been found to be terribly increasing the COVID infection or the severity, but at the same time, there are a vulnerable population, mother and child both. So we definitely strongly advise, even if the lockdown is lifted, stay at home and socially distance.
Absolutely, because that is one point of advisory that has gone on to the vulnerable, especially expectant mothers or children or even the aged above 65 plus years of age. Dr. Bansal, if I can come to you now, because there is no specific data, but we have been seeing cases now, especially when it comes to the deliveries that seem to be happening. Even if the mother is COVID-19 positive, the child has been delivered as a healthy baby. But even as healthy babies are also catching COVID-19, but there have been cases, just the recent one that came in, a baby of almost 36 days old recovered successfully from COVID-19. How do you interpret the situation?
Okay, so that's a very pertinent question. So to answer that, there have been no reports as of now whether COVID virus, it is found in the amniotic fluid of the mother or it is present in the breast milk, which is why we are not getting reports of babies born to mothers who are COVID-19 positive, that they are also COVID-19 positive. But yes, during breastfeeding from droplet infections from infected mothers, there are high chances that the baby may be getting this infection. And as we are seeing with the elders, with the elderly population and other vulnerable population, the recovery rate is also pretty high, which is what is accounting for the recovery in that baby that you are speaking about. The general measures, the general principles of treatment hold true for everybody, which is taking care of the vitals, monitoring the vitals, and giving supportive measures to treat. And we in India are doing pretty well, so which is what is accounting for the high recovery rate of all individuals, be it pregnant women, be it elderly, be it the vulnerable population, and for example, the infants also. A word of caution here for all the pregnant women who are COVID-19 positive and who are nursing their babies, the general hygiene principles apply, which means hand washing before you're handling your baby, the respiratory hygiene, which means wearing your masks, and maybe you could express breast milk and with clean breast pumps and let somebody who's not infected feed your child. Yes.
All right, Dr. Pai, we have a first caller on the broadcast. Rajesh is calling in from Chennai. Hi, Rajesh. What is your question?
Hello. Hello.
Yes, Rajesh, go on.
Ma'am, I just wanted to have a opinion. Like, there is a lot of unwanted pregnancies which is happening in this lockdown period. And since we know that, how to handle it is a bigger problem. Because there is, hospitals and, going out is messy now. So how do we handle the unwanted pregnancies? Like, there's a lot of numbers which is coming up. So I just wanted Madam opinion just to understand.
Yes. In fact, this is a huge problem because even routinely in India, we see a lot of unwanted pregnancies because there's very less, information about contraception, about family planning. And in the lockdown, in fact, we were expecting, and it has emerged the truth, that there are many, many unwanted pregnancies happening. And fortunately for us, almost all doctors are at work, whether it's on teleconsultation or in their private nursing homes or in the hospitals. So I don't think there's any patient who's deprived of a doctor's help or counseling. Up until 7 weeks of pregnancy, which means early pregnancy, we can actually offer abortion pills. And abortion pills are a very safe and effective method of termination of early pregnancies. After 7 weeks, of course, they do need to go to a hospital, and then we can do a termination of pregnancy safely up until 5 months or 20 weeks of pregnancy. Of course, the first advice is prevention. So contraceptive advice, almost all 100% doctors are available for a consultation on their phones or in their nursing homes. Please seek advice. Prevention is better than cure, but unplanned pregnancies are many, and we are there to offer you help. Please don't neglect and delay. That's extremely important.
Thank you very much, Rajesh, for the question. Dr. Bansal, Dr. Pai was talking about consultations that have been happening. What has been your experience so far because of the lockdown imposition and the kind of questions that expecting mothers or their family seems to be raising with you?
Okay, so the world seems to be evolving with this coronavirus lockdown. We have seen an increase in spurt of telemedicine consultations. A lot of people are seeking consultation over phone and over various online platforms. Various pharma companies are providing support. Various big hospitals have come up with their own online consultation platforms, for example, the Apollo Group, etc. So as far as it is safe and in the ambit of all medical care that is available, we could still go ahead and provide online consultations to all our patients, keeping a very tight balance between safety and between preventing unnecessary hospital visits. And even the Gynecology Society have come up with an opinion that we could minimize hospital visits to a minimum of few consultations in pregnancy, wherein a woman can come early in pregnancy
Dr. Bansal,
for a dating
I want you to take this question with our next caller. Vishnu is with us.
Yes.
Let's quickly take him on board. Vishnu, what is your question?
Madam, I'm from Bangalore and my daughter-in-law is pregnant in a small town in Adoni, in Andhra Pradesh. What precautions she has to take? Because one time he asked for a corona negative certificate we have taken. Again, delivery is told on May, this 31st delivery date they have given.
Yes.
1 or 2 days, more or less. So, again, we have any special precautions we have to take, madam? Because a small town, that is the way, we will inform them that is what.
All right.
Any special precautions?
So what is necessary is, sir, kindly identify a health facility where your daughter is going to deliver. Please choose the health facility. Since she is due for delivery in a couple of days, make sure they have all necessary facilities to isolate COVID positive from COVID negative patients, and they are following the ICMR protocols, the Ministry of Health and Family Welfare protocols regarding the same. Keep some mode of transportation available, because in these times of lockdown, I do not know in the small town that she is in whether facilities for ambulance etc. would be available. So kindly identify the mode of transport just in case she goes in labor. How would you transport her to the hospital? Whether emergency facilities to give trial of labor are available or not. Is there a blood bank available and which is operational 24/7? Open nearby, and are all the doctors working in that particular hospital available 24/7? Then she should understand the signs of labor. Anytime that she has pain in abdomen or she has blood or watery discharge from vagina, she immediately needs to report to the hospital. Precautions that you would take is identify a family member who would accompany her, be prepared with all the stuff that is essential to be taken to the hospital, the patient's clothes, the baby's clothes, and your sanitizers, masks to carry to the hospital, and I guess that would suffice. Be ready with your finances, because maybe the banks and all are not open 24/7. Identifying and being ready for
that
all
would be, several
the
points that to be noted, especially at the time of delivery if it is a few days away. Thank you very much, Vishnu, for calling in. We have a caller from London. Shrikant is joining us. Dr. Pai will be taking your question. Shrikant, what is that you have to ask Dr. Pai?
Hello, good morning, Dr. Pai and the other doctor. Thanks a lot for keeping this live and very helpful. My question is for young couple, and in fact it's on their behalf that I'm asking. If young couple have the bandwidth to plan their conception, plan the family, how long could they hold this off? Is this virus looking like a long-term relative, or is this going to go away, or is it going to get into a slightly benign form of enemy? So this is, how long could they hold this off is a question, really.
Yeah, must ask question, because people are scared if they are planning that what if they become pregnant and they get infected, will it affect the baby? Fortunately, it doesn't appear that even the COVID-positive mothers are passing on the infection significantly to their baby. There have been no reports of abnormalities in the child. However, these are still early days because the pandemic is only less than 6 months old. So those who were pregnant in their first trimester, we'll come to know in a few months whether the babies have any significant effects in terms of abnormality. But up until now, the vertical transmission, that is transmission from mother through the placenta into the baby, has been reported, but very, very few cases. So there is safety. And nowhere in the world has there been a warning given out that do not become pregnant in COVID times. So that is one good thing. The second thing is that now infertility clinics, those who are doing IVF, those who are doing test tube baby, even they have slowly started getting back to normal, and they have started offering fertility services to their patients, because you can't delay beyond the point. If the girl is older, for example, or there is a poor egg reserve, if the husband's sperm count is low, if the woman has diseases like endometriosis, you can't really delay these pregnancies very long. It would be very, very harmful for their fertility. And so I think there is no warning against pregnancy. However, you want your baby to come into a happier world. And hopefully that will happen in few months from now, God willing.
Thank you very much, Shrikant, for calling in. Hope that has answered your question. Dr. Bansal, we have Juma Khan joining in from Visakhapatnam. Yes, what is your question this morning?
Yeah.
Juma Khan, can you hear me? If you have your question, please do ask Dr. Bansal.
Yes. Okay. Good morning, doctors.
Good morning.
Yeah, I can hear you.
Please go on. We can hear you as well.
Yes, please go ahead with your question.
My missus she's 55 years, and she crossed menopause, and she wants to use calcium tablets, which was sent from US from my daughter. And one more thing, she's sweating more. And what precautions shall we take?
I'm sorry, I missed the last part of your questions. Precautions regarding?
Precautions because she's sweating more. Menopause. And she's lightly getting a breathlessness.
All right. So regarding menopause, see, after menopause, a lot of the women suffer from a lot of health issues. One of those is hot flushes, wherein the woman feels sweaty and she feels these spells of heat intolerance, which could be one reason why your wife is feeling a little sweaty and a little hot. So this is part and parcel of the menopause. Hormone replacement therapies can help treat it and help the woman assist during this period. As far as taking calcium supplements goes, so bone health is an important issue after menopause. Women in general suffer a lot of osteoporosis related issues after menopause, and not just calcium but also vitamin D, and if at all the bone mineral density is low as advised by your orthopedic surgeon, she could even be given a supplementation or therapy by bisphosphonates. So calcium, yes, maybe 500 milligrams twice daily initially for the first 3 months. You could get her vitamin D levels tested as well, and she could be given vitamin D supplementations. Hormone replacement therapy to treat her hot flushes, only in consultation with a gynecologist after evaluating her general health. I would also recommend that you see a cardiologist and get a general cardiac health checkup also done after menopause. Just because after menopause women are more prone to developing heart diseases as well.
Precautions, keeping all those restrictions and also in the instructions in mind that you also have to follow, because the lockdown is very much still in place. I'm completely running out of time. There has been a lot of callers calling in right now, but we'll have this conversation, more of this special broadcast that will continue to be held here on Republic. Dr. Pai and Dr. Bansal, thank you very much for taking your time out and being with us to answer all the queries of our viewers. Thank you very much.
Thank you for having us. Yeah.